Welcome to another easy nursing review. In this video, we will cover appendicitis. For more nursing reviews to help you pass nursing school, like and subscribe for more videos like this. Now, let's begin by first learning what appendicitis is. Appendicitis is the inflammation of the vermiform appendix, which is a blind pouch located near the ileocecal valve in the right lower quadrant of the abdomen that may be obstructed by stool. Because the mucosal lining of the appendix keeps secreting fluid, the pressure inside the appendix lumen will rise, limiting the appendix's blood supply. As the pressure increases, this reduction in blood supply could lead to perforation or gangrene. McBurney's point, which is situated halfway between the umbilicus and the right anterior iliac crest, is where pain is localized. Although it can happen at any age, appendicitis is most common between the ages of 15 and 30. Now let's go over the signs and symptoms of the patient. Abdominal pain that begins periumbilical and travels to right lower quadrant. Rebound pain. This means pain when pressure on the abdomen is quickly removed. Rebound pain occurs with peritoneal inflammation, guarding. This means protecting the abdomen during an assessment exam. Rigidity of the abdomen, such as the abdomen feeling more firm when palpating. Fever due to infection. Nausea, vomiting, loss of appetite. And lastly, right lower quadrant pain that improves with flexing the right hip. This suggests perforation has occurred. Now, let's go over important labs and diagnostics. The three tests you will look over are elevated white blood cell count, computed tomography scan, and ultrasound. The computed tomography scan would show an enlarged appendix or fecalith. Ultrasound may show an enlarged appendix. Okay, let's move on and learn about treatments for appendicitis. The treatments are the following: surgery, NPO status, intravenous fluids, pain medications, and antibiotics if needed. Surgical removal of the appendix, also known as an appendectomy, will be performed. This surgery may be done with laparoscopy or open laparotomy. To avoid further irritation of the intestinal area, the patient must be placed on NPO status. Because the patient is on NPO status, the patient will receive intravenous fluids until diet is resumed. Pain medications after surgery may be used as needed. Preoperatively, pain medications are taken with caution to keep patients aware of any increased pain from a potential appendix rupture. Antibiotics may be given postoperatively if needed. Okay, now let's move on to nursing actions. One action is to monitor vital signs for fever, increased heart rate, respiratory rate, and decrease in blood pressure. Next, assess pain level for changes. Another is to monitor the surgical site for appearance of wound and drainage. Also, monitor the abdomen for distension and the presence of bowel sounds. Monitor intake and output, and monitor bowel function. Well, that ends this short lesson on appendicitis. Test your knowledge with a free quiz. The link is in the description below.